All right, so you just saw that video. We just talked about myths. So learning about patients and family experience. Focus groups and surveys aren't enough. Hospitals and health systems must create a variety of ways for patients and families to serve as advisors. Something to think about. Patients and families bring important perspectives about the experience of care. They teach how systems really work and inspire and energize staff and keep staff honest and grounded in reality. They provide timely feedback and ideas. Leadership is key. Effective leaders assist in removing barriers for partnerships with patients and families at all levels of care in improvement and safety initiatives. Ensure that patients and family advisors are always involved in change and improvement activities before these activities begin. So, roles for patients and family advisors. Work groups to develop new programs, services, and facilities, peer support, members of committee, patients as educators, speakers on panels, review brochure education materials. Patient and family panels are an essential part of orientation and continuing education. And then here's a little more information. So why patient and family-centered care and not just patient-centered care? Individuals who are most dependent on healthcare are also most dependent on their families, so the very old, the very young, and those with chronic conditions. Families can be allies for quality and safety. They often are the constant support across settings and assist with transitions of care. Most people can't afford home health or nursing homes, and they depend on their family. They can participate in the development of a care plan and support adherence to the plan. So social isolation is a risk factor. Research is clear that isolating patients at their most vulnerable times from the people who know them best places them at risk for medical error, emotional harm, inconsistencies in care, and costly, unnecessary care. The majority of patients have some connection to family or natural support. In healthcare settings, patients are asked to define their families and how they will be involved in care and decision making. The American Academy of Family Physicians, which defines family as a group of individuals with continuing legal, genetic, and emotional relationship, and we talked about that. So patient engagement. Actions individuals must take to obtain the greatest benefit from the healthcare services available to them. Engagement, broadly defined, is an active partnership among individuals, families, care clinicians, staff, and leaders to improve the health of individuals. And I love how it said the blockbuster drug is patient engagement. Collaborative patient and family engagement is a strategy for building a patient and family-centered system of care. It's a priority consideration essential to health reform at 4 levels. At the clinical encounter, patient and family engagement in direct care, care planning, and decision making. At the practice or organizational level, patient and family engagement in quality improvement and healthcare redesign. At the community level, bringing together community resources with health organizations, patients, and families. And at the policy level, local, regionally, and nationally. I mean, think about if you've ever seen the movie Gleason. So there is a pro NFL player, Daniel Gleason, who has ALS. And he has changed a lot of policy locally, regionally, and nationally regarding Medicare and Medicaid reimbursement for chronic care machines. Specific for him, having a vent, having the wheelchair and eye reader that helps him speak to his family and type out words. So weaving patient and family-centered concepts into the infrastructure of healthcare organization. So thinking about your vision and values. How does your vision and values for your healthcare organization affect patient and family-centered concept? Do you need to adjust them? What's your facility design? Do you have, is your place friendly for a patient and family visit? For example, I have patients who come in with their family members all the time. Do we have enough chairs for them to sit? Patterns of care. Do we provide patterns of care so that families can easily slide in? Are we sharing information properly? Are we supporting the family? You know, we have family members who take care of maybe somebody younger than them and they have their own health issues? Are we offering them support? Where is the line on that? And that's something you have to discuss. Charting and documentation to support the family. Linking within the community. So making sure you know your community resources. The Council on Aging is a huge one. Of course, quality improvement projects that center around the patient and family concept, and professional education. Patient and family-centered care provides the framework and strategies to transform organizational culture and improve the experience of care and enhance quality and safety efficiency. So major unnecessary costs in healthcare: inconsistent quality, poor communication, errors especially in the transition and transfers, infection, unsatisfied customers, poor design of facilities. 70% of healthcare costs are due to poor hearing, meaning poor communication. Are we listening? If we ask, what are the stories we might hear? What stories do you guys have to share? So why now with patient engagement? Well, part of it is just evidence. I mean, we haven't collected evidence, but it's compelling. It is patient engagement improves quality, safety, and outcomes of care. It ensures that patients receive care that fits their preference. So when you sit and talk to this patient, you find a way to engage them. So maybe some of you work in substance abuse. How can you engage a patient in their own substance abuse? Does it involve their family? Does it involve maybe getting into the mental health aspect? It reduces the use of diagnostic healthcare services because you're getting more information from the patient. Most things can be found out through a thorough history. Of course, labs and diagnostics are important, but a thorough history and getting all the pieces are really helpful, and it decreases healthcare costs. Increases buy-in to prescribed treatment. If you have someone who has no desire to start insulin and doesn't understand why, do you think they're going to use their insulin at home? Absolutely not. Patient experience and satisfaction scores will also go up, and so will yours. Staff and clinician satisfaction. How many of you have gotten a name on the admission call sheet and been like, oh my gosh, he's coming back again? What are we doing wrong? Why doesn't he just listen? It really, bothers you. At least it does for me. So the triple aim is, treating health populations, reducing costs and patient experience, but the quadruple aim is increasing staff experience. Transforming healthcare is a safety imperative. We envisage patients as essential and respective partners in their own care and in the design and execution of all aspects of healthcare in this new world of healthcare. Organizations publicly and consistently affirm the centrality of patient and family-centered care. They seek out patients, listen to them, hear their stories, are open and honest with them, and take action with them. The family is respected as part of the care team, never visitors in every area of the hospital, including the ED and the intensive care unit. Patients share fully in decision-making and are guided in how to self-manage, partner with their clinicians, and develop their own care plan. They are spoken to in a way they can understand and are empowered to be in control of their care. The best care at lower costs. The path to continuously learning healthcare in America. The IOM report has 10 key recommendations. Involve patients and families in decision making. Patients' need and perspectives are factored into the design of healthcare. In growing number of instances where truly stunning levels of improvement have been achieved, leaders of organizations often cite that putting patients and families in a position of real power influence, using their wisdom and experience to redesign and improve healthcare systems.